As of 2025, COVID-19 remains a globally circulating virus, though its threat has significantly reduced compared to earlier stages of the pandemic. While widespread vaccination and natural immunity have helped curb the virus's impact, it continues to pose public health challenges, particularly due to emerging variants and the ongoing burden of long COVID. The Omicron subvariant JN1, a descendant of BA2.86, is now the most prevalent strain globally, accounting for up to 90% of new cases in some regions. This strain is highly transmissible but has not been associated with increased severity. Other recombinant variants, such as XEC, and flirt variants like KP2 and KP3, have also been identified across multiple countries. Despite increased transmissibility, these newer variants generally cause milder illness, and current vaccines continue to offer protection, especially against severe disease. Vaccination remains a key tool in mitigating severe illness. Updated vaccines for the 2024-2025 season are recommended for everyone over 6 months old. However, uptake has been uneven. For example, in the UK, only 59.3% of eligible individuals had received the autumn booster by early 2025. Recent data estimates that Moderna's updated vaccine is 53% effective against hospitalization and 39% effective at preventing medically attended illness within 2 months of administration. While not perfect, the vaccines remain an essential defense, especially for older adults and vulnerable populations. Long COVID continues to affect millions worldwide, often presenting with symptoms like fatigue, cognitive difficulties, and shortness of breath that last for months or even years. Alarmingly, new research suggests that COVID-19 may accelerate cognitive decline in older adults. Those over 65 with long COVID are twice as likely to experience moderate to severe cognitive impairment, and up to one-third meet criteria for mild cognitive impairment, resembling early dementia. Additionally, recent findings show that COVID-19 may increase the risk of other infections for at least a year after recovery. Ongoing research is exploring therapeutic options for long COVID. While a definitive cure has not yet been found, scientists are trialing a combination of medications and rehabilitation techniques to treat long-term symptoms. Pharmaceutical companies like Moderna and AstraZeneca are also showcasing new infectious disease research aimed at preparing for future outbreaks. The pandemic has left lasting impacts on global healthcare systems. Many countries, especially low and lower middle-income nations, are still working to rebuild essential services and infrastructure. A WHO report from early 2025 indicates that up to 24% of countries are experiencing healthcare funding shortfalls, leading to higher out-of-pocket costs for patients, further straining vulnerable populations. COVID-19 also disrupted routine medical care, with nearly 1 million cancer diagnoses missed due to delayed screenings and treatment. In response to the pandemic's lessons, WHO member states are finalizing a legally binding international pandemic treaty to ensure better global preparedness for future health emergencies. The treaty aims to address systemic weaknesses, such as fragile supply chains, inequitable vaccine access, and poor surveillance coordination, which were exposed during the COVID-19 crisis.